All right, so let's talk about how we're going to set up our client for a prenatal. Now, one, you might not have this big wedge, which is honestly just a luxury. Some tables will actually have like a mechanic where you can actually tilt and elevate one side of the bed at an angle and to put them into what's called the semi-reclined position, which is really nice, you know, to be able to use the semi-reclined position because it breaks up that monotony of only keeping them inside lying. But we'll look at, you know, massaging in both positions, and then you can easily transfer from the semi-reclined position to do side lying. So basically, what I will do is have them face up with the semi-reclined position, you know, do everything. And it's basically just using working on a supine client at this time with the upper body just angled up, but the routine's the same. And then after I do a full supine massage, then I'll turn them onto their left and right sides, and that's basically your whole routine, right? So if you do have this set up, you know, it's pretty simple, pretty easy. Sometimes the wedge isn't enough to hold their upper body, so that's why I have the extra pillow here. But you're just going to explain to your client, you know, of course they're going to undress to their comfort level. Then you'll explain to them that they're going to get under the top sheet here. They're going to lay with their back right here, you know, just in that, you know, seated up position, and then just cover themselves back up with the top sheet. It might be a little challenging to get on the table at first, you know, so you might actually want to keep your table low if you can. Plus, with the semi-reclined position, you're going to have that angle, so you want your table lower normally than you would normally have because of that reason. So if you have the electric lift table, that makes it really nice, and then because you can adjust the table height as needed. Plus, usually with side lying, a lot of the, you know, routine is going to be best done in a stool, just for the angle at some of the tissues you'll have or will have, and you'll see that. So, you know, the table lower is usually a little bit better. But, you know, once we're, you know, explaining to our client, they're just going to get under the top sheet here, undress to their comfort level, cover themselves back up, and just lay nice and comfortably. Cool. I will also say that you might want to have an additional small cushion to place under the right hip to shift them to the left a little bit, because in traditional, I guess, run-of-the-mill, you know, standard protocol that people like to talk about with prenatal massage is to massage them only on their side and always on the left side, which is kind of dumb. I mean, I've had pregnant people where they're like, yeah, I sleep on my stomach. Like, oh, you know, 3 months or a third trimester in, they're sleeping on their stomach. Like, okay, cool, good for you. But the reason for that is of the prevention of a condition called supine hypotensive syndrome, which is, well, supine, lying on your back. Hypotensive means low blood pressure. So what happens is the fetus can shift and compress the blood vessels that are run along the right side of the spine, namely the inferior vena cava, which then causes blood pressure to drop. It, you know, not as common as, you know, we'd like to say, but of course, why chance it when we can avoid it by shifting them just a little bit towards the left, so that way, you know, the weight of the child, the fetus, you know, shifts that way as well. So just to consider, you might want to have a little cushion to put under the right hip in that scenario. All right, so let's go ahead and get our client on the table, and then we can get into some massage. All right, so now that we have our client on the table, like I said, we pretty much can just enact our routine just like we normally do for a supine routine. So very similar to everything you're already doing, right? If we're going to initiate contact, we want to explain that ahead of time, right? I'm going to place my hands on your shoulders. Go ahead and take a deep breath in, and exhale and relax. So a little compression on the shoulders, just push those shoulders away, get a little stretch on the traps, and then we can do the alternating compressions. Let that head rock side to side. Remember, we want to keep our hands, you know, palm up, so I can gently cup the shoulder instead of here in like a groping action, or like out here and like pressing on the bony front parts of the shoulder, and just gently compress and move. Coming up underneath the neck, we can do the curl. You okay?
Sorry, yeah.
You sure? Mm-hmm. Okay. So we can do the circular friction along the neck all the way up to the base of the skull. So basically I just have my hands curled, press into the sides of the neck, right into the, little muscle tissue there. And then I'll work my way up to the base of the skull, where I can do the little cradle technique, where I just cradle the head and just curl my fingers right into the base of the skull, the ridge of the skull. And then again, I can do that circular friction work. Of course, we can always do scalp and face massage, especially right now. As you can see, we kind of walked our hands up to get into position where we can do the scalp and face. Remember, I like to do the face first because I don't want to get the products or, oils from the scalp onto the face, but we'll skip all that for now. Then we can get a little lotion for some gliding techniques. If they're okay with the pec work, I can do some heart-shaped effleurage coming over the chest and pulling back on the neck and shoulders. And then we can apply our nice deep fist glides right there into the traps. Remember, scoop up underneath. Like I said, this is the same as your supine techniques, right? As your supine massage. You can move over if you want. Get a little better angle instead of seeing around her. You're fine where you were. Now you're blocking her. Jeez. What am I gonna do with you kids? But anyways, just the same thing, right? Where we're doing the deep fist glides, glide out, and then I can turn the fist up and pull those knuckles back right up along the neck. We can do that little knuckle scrape, knuckle petrissage on the back of the neck. If you need to review any of the techniques, you can always watch that video again. Right? We can do the little clasping, duck pinching type petrissage. Right? We can do the rope pull on the neck, where we curl our fingers and then just pull right alongside the neck. Of course, we can even do the pin and stretch, where I press in with the fingertips on the side of the neck like that, push that shoulder away, right? Get the muscles to stretch out underneath you. I can turn the head to the side and work one side, a little bit more detailed with the fist glides and the cross arm stretch. Stretch out this neck muscles. You got to think, like with your pregnant clients, where your focus is really going to be, low back, feet, legs a little bit too, but upper back too, right? Right, you already get like back pain because of the weight in the front of the chest. Well, that's increasing during pregnancy, right? Plus the weight of the child, right, and everything gives the low back pain. The extra weight, onto the feet, and usually the feet and ankles will swell too. So, I'm just kind of like, just doing like some pulling, but and petrissage here, but I could do like those envelope glides like I've done before, and work the, deeper muscles like the scalenes in the inner neck. And then of course I could do that on both sides, and then we can still do our stretches, just to give a few examples. The chin to the chest stretch. They should feel that all the way to the low back, right? And of course I can come in and, you can see this is just a nice position too, not just for prenatal, but regular clients as well. Look at the comfort I have to be able to stand and do the neck and shoulder work like this, right? So yeah, if you want to like take a quick little shot of the body mechanics here, it's just like normal massage. It's really good position just for anybody, so I'm doing that little snake bite technique right there. And I'll just lean her head back. So then we can work into the arms. And so we can work the chest too, right? So gliding on the chest, I like to do that little push-pull on the chest, like one hand curls underneath the shoulder, one hand on top of the chest, and then I just kind of like pull them both back. We can work the delts with the shearing glides, shearing petrissage. right? Lazy petrissage, yeah, we could try. You know, as long as we have enough support from that bolster, should be okay. Yes, make sure you hold the baby. Hold the child dearly, right? We can, you know, with the angle, it makes it a lot easier to do like the praying hand petrissage, you know, squeezing on both sides here. And of course, you know, regular arm work is always the same, right? We can work biceps, triceps in this position very easily, right? We can work into the forearms and hands as well, just like normal. So, you know, we'll just speed through a little quick demonstration of the forearms, a little thumb gliding here. Hand massage, same thing. You know, insert all of your cool techniques here. Ooh. Don't forget the lotus, little lotus spread. Oh, fancy. Nothing better for a pregnant client than this. Oh, maybe. We can still do stretches too, right? So maybe I get my lotion off of them a little bit, degrease them, so I can get some grip. But I could do the pull, right? And stretch the traps here a little bit. A little traction on the arm. And we can do stretches on the legs, we'll get there. But, you know, depending on the trimester, you don't want to, because when they're in the third trimester, their body is preparing to, you know, have a child. And so a lot of hormones get released to relax the structures in the pelvic complex. And so there's a loss of integrity there. So if you do traction like on the hips, you know, you could tear something, you could, you know, could potentially hurt the complex there. Of course, we could do like an overhead lat stretch. Again, I'm going to pull the drape over them, keep them nice and covered. I can stretch out the lats a little bit. All right, same thing. Keep that drape tight. Come over, and then I can even do a little arm across the chest stretch. You know, don't go, I mean, you don't go too crazy. I know we kind of like talk about prenatal and pregnant women like they're fragile, but we've been having children since the dawn of our existence. I mean, if we didn't, I don't know how we got here, right? So, you know, they're pretty durable, right? And you see how that led me, right? Same thing, right? Like when we did our normal supine work, right to the other side to, you know, do the same part of the routine, right? So, you know, if you just do your regular supine upper body routine, nothing crazy, nothing new there. So we can come to the leg, and then draping the leg is exactly the same. And you'll see this is actually going to help us out too when we do the side lying, right? So same thing here. Now, couple things to be mindful of is one condition of, you know, pregnancy we do want to be careful of is like eclampsia and, you know, signs of what's called preeclampsia, which is usually indicated by widespread swelling in the legs, you know, kind of like splotchy spreading or swelling. So if you see like weird, you know, not like even swelling, and especially swelling that's not like in the normal places, which, you know, a little swelling around the ankles and feet so is like normal. But like really like high in the inner thigh and stuff, and like really around the thighs and stuff, you know, it's usually probably bad. But, you know, women are, you know, pretty adamant of, you know, seeing their doctor regularly. So like if they're having complications, they would probably know before you did. So, but, you know, just normal massage here, right? We can just do our palm glides, right? Fist glides, all that good stuff. Remember, I don't really like to do the forearms just because it's awkward. Like, hey, how's it going there? We can do the shearing glides across the thigh. A little pietrissage if you know, can get your hands around there if you really want to. A little push-pull action. Keep that drape nice and tight. Work around the muscles of the inner thigh. Some petrissage. Roll the thigh in a little bit, hit the IT band. They might not be able to do this, but depending on the pregnancy and, you know, just how much baby bump they have, but you could potentially, like we've shown you guys, right, where we bend the knee up, right, and we can work the quads. I'm just going to try to brace the foot so it doesn't fall out, but we could work the quads. You know, so I definitely wouldn't put a whole lot of traction into the hip and low back like that with this technique, but you know, same thing for our normal stuff here. And then like the curl finger and stuff. Put the foot down. And then, you know, it can still work our calves, you know, works really well too. If we have our stool, right? Or we can do like that rope pull. Hit those calves, curl the fingers in, just pull. A little palm spread technique on them. All right, you can hit the shin muscles here, the little dorsiflexors. You can work the foot. Now, I know you're gonna hear from all these people, there's a spot on the foot though, right, where we can induce labor. Let me tell you this, I've talked to a lot of experts, both reflexologists and legitimate doctors, and they say it's a load of crap, right? And I mean, think about it, right? If there was an auto eject button on the bottom of the foot, we'd be rich, right? We'd have so much money. Please poke my foot. I just got pregnant last night. Screw plan B. Here, take my foot. Trust me, it's not true. And I had some therapists like, I did it once. I was like, well, what were the circumstances? Well, she was 2 weeks past due. Like, really? Like, you don't think that was just coincidence? Anyways, my rant. Anyway, so we're doing our curl finger glides here on the foot. And then, of course, we can, you know, have a seat in the stool where we can, like, thumb strip, fist glide, right? Praying hand on the heel. All that good stuff. Right, crack some toes. Like I said, you know, just be careful and mindful if there is any swelling around the ankle and foot. You know, just be mindful of that. So, what you can do after this point, right? Now, I'd probably do both legs still, but when I'm ready to turn them on their side, I'll actually just swap legs. That way we can use the side towards the camera. When we're actually ready to flip them, what we can do is, or excuse me, not flip them, but turn them on their side, we can drape the leg just like normal. And this works for your regular drape too. So remember how we showed you guys how to do the flap where I keep taking that edge and then just turn it around. You see how I tuck it under the hip, right? And leave it right across. So that's gonna have that flap right there under the belly. And so now what do is, I'm gonna take out this bolster. Could you just lift your knees for me? Because I don't wanna have them laying flat just yet. And then I'm gonna take out the wedge. So I just need you to sit up real quick. Take the wedge out, and you make sure you tell them to keep the drape close to the chest, and you can lay back. Okay, and now what I'm gonna do is I'm gonna hold the sheets here. Go ahead and turn onto your side. And you see how that keeps nice and tight, right? And then, you know, if I need to fix it up, tighten it up a little bit, boom. But that's our sideline drape. So you can do this same drape, yeah, and they can hold that if they want. But what I do is, with that same pillow, now, of course, it would be better if you had a body pillow, but could you, I'm gonna swap out some things here. Go ahead and lift your head up for me. Go ahead and put that head down. So you can use the headrest cushion for their head, and then I'm gonna give them that pillow they were just laying on to hold tight to the chest. So go ahead and hold that nice and tight to the chest. Go ahead and hug that pillow. Why? Because that's gonna keep the drape tight to the chest too, right? And so, because when we do the drape of the back, it's pretty much where we just fold the sheet back like that. And I don't want it to get loose to the chest. So if they hug that pillow tight, you know, then we're pretty good. And then for the for the knees here, I usually say, could you straighten out the bottom leg and then just put that top leg, boom, right there. Like I said, it's gonna be better and easier if you have the body pillow, right? Now, I'll demonstrate the how you would do the drape if they were already in side lying, but the leg wasn't draped. It's pretty much the same end result though. So, you know, you can usually get to it. The only problem is if you, let's say, start with your client side lying because you didn't have that wedge, you kind of can't leave them face up, so you have to leave them on their side and then do the drape side lying. So that's the only reason why you'd normally have to. But like I said, it's going to achieve the same end result. And then, honestly, it's just a little more hassle. So ideally, it is just pretty much easier to drape the leg like we showed you, do the flap, and then turn them. And this works for regular clients, right? So you know, regular clients who don't want to like lay on their back or anything, or excuse me, lay on their front, you know, you can just have them face up, drape the leg, turn them on the side, work side lying, turn them back over, go to the other leg, work that leg, turn them, and then that's like a whole routine in and of itself. But anyways, so now one thing I will say to consider is the space on the table. If, let's say, they don't have as much room here, just you know, just like I would just like back up here and say you can like scooch back. You don't have to right now, you're fine. Just so that they, you know, have more space this way, because I can work this way, and all my pressure is going to push them that way, so I don't want them to get scared to get rolled off. Like, haha, no more baby for you. No soup for you. All right, so, yeah, we can always make that nice and tight, nice and tight. You okay with that drape there? Yeah. You can always ask them if they're okay with the drape. Like I said, you know, your average client with prenatal is, they don't even care, but you still want to respect their modesty. But as you can see, all we have to do, and at this point, it's the same as back massage, right? It's just our angle changes. And this is why the stool is really nice, because it gets me in that position for our work, right? So one hand on each side of the spine, but you can see how this top hand is like internally rotated, and you know how I don't like that, right? You've heard me say that enough times already. So you could just use one hand at a time, excuse me, one hand at a time. All right, so I can do my fist glides, palm glides, right? And of course, make sure you can work both sides of the back. I'm just gonna tuck this in for you. I mean, you can even do forearm glides if you really want. Forearm glides would actually probably work with that top arm really well. Get in there, you know, with a little bit more pressure, and you know, it's just easier on the shoulder with this. Or you can do, you know, if you're really careful with your contact of the forearm, you know, you can do kind of like that forearm glide here, like we do like forearm in the glute glide, which, shoot, we can still do. Now, like I said, you do want to be careful of the hip complex, but you know, I can rest into the hip and then glide up. You know, like I said, you like do respect your client, and you know, don't go super crazy on them. But you know, female clients are definitely a lot, or prenatal clients are definitely a little more durable than we give them credit for. But you know, a little forearm in the glute glide up. So remember, one forearm rests here in the glutes, which should feel really good for them, right? So of course, their main focus would probably be low back. Now again, you do need to be careful with the low back. So I'm not going to do a whole lot of like hip movement, like the push-pull and stuff, because it is possible to dislodge the placenta, and that's not a good situation. So, you know, I'll just keep it pretty easy, right? But I'll do like the little kitty biscuits here, or I'll do like the heel palming, where I just get that heel stripping up the low back. Of course, I can do the shingle glides in the low back, one fist, you know, gliding after the other. And I mean, if I have the room, I could do it on the other side, but you got to think we're going to flip them, so we can save one side for that that flip, right? So you can focus more on the top side just because it's typically a little bit easier access. You can do the forearm saw in the low back, right? I can come in for some petrissage, right? I can do that little grandma's rolling pin fist work, right? All right, nice good stuff there. And I can work in between the shoulders, you know, so if I'm gonna work on the upper back, you know, I might pull that drape down tight again for them. So they're nice and, you know, covered, respected, right? And I can work in between the shoulder blades, like the scapular push we talk about. So I can use my thumbs, I can use my fists, right? Really get in between those shoulder blades, right? Hit some forearm glides in there too. This is also another reason why you'd kind of want them closer to the edge of the table, closer to your edge of the table, you know, so that way you don't have to lean super far across the table to hit them. Working in the traps, again, pretty easy. This is where you can get really good pressure on the traps because, you know, I can just literally lean all my body weight in on them right here. And in side lying, it's actually one of the best positions to work the neck and shoulders because it's open and I have free access. Can I just grab your head here? Free access to take the head in essentially any direction. If I take this pillow out, then I can even, you know, bring this ear more closer to that shoulder, right? So it's a lot easier, better range of motion and access the head for all those other stretches we've done before. Working the shoulder still, I can come in, and if they're okay for me to have a seat, right, I can sit here and work the shoulder, you know, a little bit more intimately. I could kind of come up underneath the scapula, right? So I'm just going to steal this arm from you. I can even keep that drape tight, rest their shoulder or rest their arm interlocked with mine and just do like some traction technique and work the traps here. You know, I can definitely get underneath the shoulder blade right here, see? If I really want to get up under there, right? You can still do like all your stretches too. You can still work the chest. I just, you know, figure we already did, but you don't have to, but I can do some stretches and work the chest in this position. Just make sure that drape stays real tight to the chest, of course. You know, that's, again, one of the reasons for that pillow. You know, some range of motion. You know, we can kind of do that chicken wing stretch we like to do. You know, pec stretch. Of course, we can even do the overhead lat stretch. Now this is, again, I probably wouldn't do this with every prenatal client, but you know, just for the fact of using side lying for regular clients is also pretty nice, where I can actually place a hand on the hip and counter pull the shoulder and hip in opposite directions, right? And then just generally traction and pull, hit those lats into a nice little stretch. Yeah, and then of course, like I said, you know, we can pretty much do the rest of our low back techniques that we did before, and then we'd have to double that up, of course, because, you know, we can flip them over to the other side and then do that. Working the legs, honestly, this is like one of the best positions for the glutes to be to work them. All right, so make sure this is nice and tight. But it's because the tissues are straight up to us. Just like when we work the back, when they're face down, the tissues are pointed straight at us, right? So we can literally do, you know, direct pressure into the glutes. So we can do, you know, of course, our glides with palms, fists, forearms, right? All of the trifecta there, right? I can do kind of like that scapular push, because remember the hip is quite similar to the shoulder, so we can do like that scapular push, go from the edge of the sacrum right out to the greater trochanter of the femur, right? We can do the petrissage. Remember, I'd like to do the two fists, so I'm not like in that groping hand position, right? So a little double fist petrissage, and of course, you know, just straight compressions would work too as well. It would be a little difficult to do the pin and stretch that we've shown you, right, where we're rotating the leg in and out. So we can just X-nay that. And then coming to the other side, you know, wonderful way to work the IT band, right? IT band is just pointed straight up at you. But it's also, we can work both quads and hamstrings at the same time, right? One fist on each side and then glide up, right? And now keep in mind too, that bottom leg is still available, right, for some work. So little fist and quads and hamstrings here with the two fists, kind of like make a sandwich with your fists as you hit both quads and hamstrings, right? Palm spread and push-pull here works as well. Just be careful of that inner thigh. You know, of course, we can work the calves and feet. But as you see, right, we can work the, you know, if we drape the inner thigh, drape the other leg up a little bit more, right? We can work the inner thigh, hamstrings, quads, really, calves, feet, right, of the client here. Now, like I said, once we're finished with this side, we could just have them roll over, so roll back over. So let me go ahead and have her come back into position. So I'm going to keep that drape nice and tight, and then go ahead and roll onto your back. You see how that drape's nice and tight. We didn't get anything exposed. So then I'm going to drape like normal. And then of course we would just drape the other side and then rotate her. But let me just show you the drape if they're already on their side. So go ahead and turn to your side again. Other side, just so I can, just so I can show for the camera. All right, so it's a little bit more difficult, and honestly, you know, you run a lot more risk of potential exposure. So if you can, do the supine drape, leg drape, and then turn them, you know, it's a little easier and it's faster, right? But I basically want to just like pull the edge of that drape up, keep it nice and loose, so you know we don't get to see anything. And then there's one of two ways you can come under and through the legs. You can either pull the front end of the drape that way, or the back end. I prefer the front end because I'd like to keep that covered. You know, I feel like that's a little, you know, if God forbid something gets exposed, I'd prefer the back side be exposed than the front side, right? Would you agree? I mean, don't try to expose anything, but, you know, should something happen. So we might need to pull a little bit more sheet onto this side to come underneath the leg. So I'm going to take that edge and that corner, right, the same corner and edge, I'm going to come underneath the leg. And then now we make our flap, right? Just like we did before. And then I'm just going to make that flap. And then basically keep that tight, right? And you just kind of shimmy and walk the diaper up. And keep it tucked. And there you go. Now you see how though, when we do it like this, both legs end up being draped, right? And you know, with the other way, the other leg was able to be covered in case they get cold. And usually pregnant people complain about being hot more than anything. And you see, now we can just kind of use that drape to get into the legs, right? And I mean, like I said, you know, it achieves the same goal, just a little harder. I don't know, in my opinion, a little harder, right? A little more work, and you know, a little more risk to it. But you know, it looks clean, looks good, right? Same thing. And then to undrape it, you just take that mass, and then you just slowly start to slide it down. You know, take that diaper down and just, you know, try to not uncover them. And then just poop, 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 poop. And there it is. And then at the finish, we deliver the baby. All right, so let's go ahead and try to massage some pregnant peoples.